The potential link between vitamin D deficiency and weight gain is emerging as a deeply concerning area in modern health research, and the scientific community is still struggling to fully unravel the intricacies of this connection. While the idea that low vitamin D levels might contribute to increased body weight or obesity may sound speculative at first, the growing body of evidence cannot be ignored. Despite the widespread belief that excess body fat simply traps vitamin D and thereby reduces its availability, this explanation feels increasingly insufficient in light of the more complex biological processes involved. And the real risk is that this underestimation may leave many people vulnerable to long-term, systemic health consequences driven not only by obesity, but by the silent deficiencies that often accompany it. Vitamin D is far more than just the sunshine vitamin. It is a steroid hormone that plays a crucial role in hundreds of physiological functions, including immune regulation, bone metabolism, and cellular inflammation control. When levels drop too low, the consequences can be both immediate and long-term, ranging from subtle fatigue to full-blown skeletal deformation, even in adults. In fact, vitamin D deficiency has been associated with a higher risk of developing chronic diseases like cardiovascular issues, autoimmune disorders, and metabolic syndromes. But what makes the link to weight gain particularly troubling is how easily it is overlooked and how often it is misinterpreted. For one, vitamin D deficiency does not always manifest with obvious symptoms, and overweight individuals may assume that general fatigue or mild depression is a side effect of weight alone. This creates a vicious cycle. Reduced energy and increased inflammation lead to reduced physical activity, which in turn lowers sun exposure and vitamin D synthesis. Compounding the issue, adipose tissue actively stores vitamin D, but in doing so may lock it away from the bloodstream where it's needed. Thus, the more body fat a person has, the more vitamin D may be sequestered and rendered biologically inactive, even if total levels appear normal. Alarmingly, some studies suggest that the metabolic dysfunctions associated with obesity might actually be worsened by insufficient vitamin D. Low levels have been linked to chronic inflammation in fat tissue, which can trigger insulin resistance and other disruptions in glucose metabolism. Over time, this low-grade inflammatory state may be enough to push a person toward not only weight gain, but full metabolic syndrome, a dangerous precursor to type 2 diabetes and cardiovascular disease. More concerning still is the inconsistency in supplementation outcomes. While some individuals report improved energy and slight weight reduction after correcting a deficiency, the results are highly variable. This unpredictability is a warning sign in itself. It suggests that vitamin D deficiency may not just be a side effect of obesity, but also a contributing factor in its progression. If this proves true, then failing to address vitamin D status in overweight patients might mean missing a key therapeutic target. The current diagnostic approach is also problematic. Many health providers still view vitamin D deficiency as a secondary concern, something to monitor perhaps, but not urgently treat unless bone health is in immediate danger. But that passive stance overlooks the mounting evidence pointing to vitamin D's broader roles in regulating appetite, energy expenditure, and even the activity of fat-storing hormones. Moreover, reliance on blood serum levels to determine sufficiency does not account for the fact that bioavailability can be sharply reduced in obese individuals due to how vitamin D is stored in fat. Adding to the danger, lifestyle factors that contribute to deficiency, such as poor diet, sedentary behavior, and lack of sun exposure, are all more common in people struggling with weight. Yet rather than seeing vitamin D deficiency as a compounding risk factor, the medical system often treats it as a benign finding. The risk of this complacency is that patients may experience worsening weight gain and systemic inflammation without realizing there's a biochemical driver that could, at least in part, be modified. The ambiguity of current research only intensifies the problem. While some studies have found that supplementing with vitamin D can improve insulin sensitivity and reduce body fat in deficient individuals, others have shown little or no effect. This conflicting data has led to confusion and skepticism among both doctors and patients. But that uncertainty shouldn't be interpreted as proof that vitamin D is irrelevant to weight. On the contrary, it may mean that we're not yet fully understanding the mechanisms or how best to target them. What is certain is that when deficiency is present, especially alongside obesity, the stakes are higher than we currently acknowledge. Even more unsettling is the possibility that vitamin D interacts with the very receptors in fat cells that regulate whether those cells grow or shrink. Some researchers have found that vitamin D receptors are altered in obese individuals, which could mean that fat tissue behaves differently depending on vitamin D status. If that is confirmed, then deficiency might not only accompany obesity, it might actually change the way the body stores and burns fat. In the face of such uncertainty and potential harm, the safest course of action is not to dismiss vitamin D deficiency as a secondary problem, but to treat it as a serious red flag, especially in patients experiencing weight gain or struggling with obesity. More rigorous studies are needed to clarify causality and identify whether supplementation can be a viable intervention. But in the meantime, ignoring the issue could allow hidden inflammatory and metabolic dysfunctions to spiral out of control. Vitamin D deficiency is not a harmless byproduct of modern living. It may be a critical missing piece in our understanding of obesity, a disease already laden with complexity and stigma. Failing to address it thoroughly, especially when signs point to its deeper involvement in fat metabolism, risks prolonging suffering and delaying effective care for millions of people.